So, Chris, what in the world are we listening to?
I hope everybody knows their music. That's why we have to lead in with this.
That's right. It is the MedTech Jam Session, after all.
Yes, it is. I'll tell you in a second. This is so good.
Hard not to dance, isn't it, Chris?
If you're about 7 or 8 years old, I don't know, 45 years ago, this was the original theme to SWAT. And any kid, most guys, obviously, it was a big deal to sit and watch that whatever night it came on, Monday nights, I think, something like that. Weird stuff sticks in my head as to what shows came on what night. But yeah, it was a great lead in. And it was actually not made for the show. It was something that had already been recorded by an R&B instrumental band.
Okay.
And so, but it stood the test of time. And even today, with the latest version of SWAT, it's still there as the lead in.
Is that with Samuel L. Jackson, who I rode in an elevator with a long time ago? All right. Welcome to MedTech Jam Session with Chris and Mike D. I'm Mike Donahue.
I'm Chris Lyons.
And thanks again for joining. We're super excited today to have another amazing founder. We're going to learn a lot from him about how quickly he got his company up and running. It's amazing, actually.
Yes, it is.
We're going to learn a lot about that from our friend Tom Gamache from Native Orthopedics. But first, Chris, I wanted to probe a little bit, since I think a lot of our listeners will be first-time founders or even surgeons with ideas.
Yep.
Raising that first dollar, sort of that pre-seed round. What is your advice on where to go? That friends and family round, the angel round. What sort of insights? What can you share with first-timers?
Sure. Well, I think the first thing that everybody has to ask themselves is why just a pre-seed round, and truly how far is it going to take you? And the reason I mention this is because for VC and capital funding and things of that nature, everybody understands the playbook has always been do that at a Series A or a Series B or whatever. And everybody in their mindset is like, I want to minimize dilution from the get-go. And so that's why it's friends and family and things of that nature and control and the ability to set terms. And I'm not against it whatsoever. The key is knowing how to find these people. And I don't mean friends and family. That's the easy one. But it's knowing how to find the angels. It's knowing how to find the high net worth individuals. It's the folks that will come alongside you and could believe in you from the beginning. It is not common that you're going to strictly have friends and family and high net worth angels and things of that nature alone if your plan is to go through commercialization. It's going to definitely take further funding, and it could be at a VC level. And I don't want people being scared of the word dilution. It is something that in our space, and I'd say most spaces, you should expect it to a degree, right? You're not going to give away the store, but at the same time, I know very few organizations that hold on to greater than 50% as founders in their businesses. Yeah. So as you enter the pre-seed state, you want to be buttoned up with your presentation, and you want to be buttoned up with the one-page teaser, and you want to tell a convincing story of where is this pre-seed going to take you through. And it really needs to be through a milestone that is meaningfully tangible to those that have just put the money in. Okay. What you don't want to do is you don't want to get so far out in front of your skis that you're evaluating yourself at a crazy price per share. Honestly, I see a lot of price per shares that are way over the top, way too early. Okay, drill it back, be it $1.25, something like that, and then go from there, right? Because eventually you may need that VC, and you don't want the guys that have come on to get crammed down, the first ones that actually believed in what you were doing. So I would say that's my quick advice relative to the fundraising.
Yeah, that's super valuable. I think it's important for our listeners to look at the data. So if you're not familiar with Carta is a great resource for you, carta.com. They've got loads of resources, and they just put out their State of Pre-Seed 2024. And this just highlights the challenge of raising money right now. If you look at Q4, $716 million went into pre-seed startups in Q4, down from 965 in Q3 and down from 1.2 billion in Q2. And it appears that the distribution of these deals is shifting towards smaller rounds. Now, this is all of startups. This is not just med tech. So some of that could be biased towards SaaS or AI.
Yeah.
So it's hard to know. But what was interesting, this little interesting bullet, safes are becoming more popular for medical devices. So if you want to consider what instrument you want to use, do you want to use a convertible note, or do you want to consider a simple agreement for equity that the Y Combinator guys put together? A majority of pre-seed cash raised last year by medical startups was on a safe, which is different. So anyway, I would just present that to you as something you can consider. Go to Carta, and there's a lot of those resources, particularly if you're a first-time founder, so that you are prepared when you're ready to raise that first dollar.
Yeah, and it won't be too long in the future that Mike and I have already had discussion around bringing in some of the investors at different levels. Who are some of the pre-seed folks, and who are and what do they look for, right? What are the A's looking for? What are the B's looking for? And what do you need to expect and get your mind set toward as a founder owner of your operation?
Yeah. Great point. Yeah.
It'll
be exciting to have some of these investors on, because I think they'll be able to bring some unique insights to the medtech ecosystem.
Absolutely. And clarity of expectation.
Yep. All right, let's get into it with our guest. So Chris, you want to introduce our guest?
Absolutely. Tom Gamache. He's much like me and Mike in the fact that we have all been industry, working for the corporate large organizations over our careers and span of our careers. And Tom has an extremely hot technology in the Dragonfly product for native ortho, working in conjunction with Dr. Chris Anderson. The thing that I've loved about getting to know these guys and getting to see the tech is that they've already run the gamut in terms of product design to land at the Dragonfly product. I love the name. I'll let Tom explain the rest. I don't want to take the thunder there, but it's a pleasure working with these guys, a pleasure working with Dr. Anderson as well.
All right. Welcome to the stage.
Well, thanks, Chris. And nice to meet you, Mike.
Yeah, great having you here. So Tom, just to get started, why don't you give us a little bit of your history and your journey to entrepreneurship? I think it's pretty interesting what you shared with me earlier.
Yeah, sure. So I'll take you back to high school. I went to a vocational high school. I was in drafting, and I worked a co-op job my senior year of high school. The job I was working for was a lighting company. They offered me a full-time position working for them, and they said, hey, we'll pay for your college tuition if you go at night. And coming from my family background, I weighed the pros and cons of that versus the traditional path. And I ended up choosing that harder path, where from 97 to 2004, I went to Northeastern University at night, but I was during the day launching products in the lighting space. So fast forward, I have my degree in mechanical engineering and landed a job at Johnson & Johnson in 2005. I started as an entry-level engineer in spine. I spent 15 years in spine, worked my way up into R&D management. Then an opportunity presented itself at our sister company on the same campus, MyTech, sports medicine, and shoulder reconstruction. So I joined them about 5 years ago. And I wasn't on the job too long. COVID was just hitting, and I was tapped on the shoulder to be the R&D diligence lead for a novel total shoulder system, which is now part of J&J family, called Enhance. So I led this diligence opportunity during COVID, all remote. And it was a great experience, which actually, overseeing internal innovation is fun, and launching products and building teams to do that is fun. But the BD side really caught my interest. So I leaned in on that. It got me involved in a lot more conversations and diligence activities, got to see a bunch of pitch decks from startups and evaluate technology and take some things to the finish line. I had a choice to make in my career, to be honest with you, Mike. Lean in on the vice president path at Johnson & Johnson, or sit on the other side of the table as a founder. So that's how I arrived here. Is I did a lot of self-reflection and decided to lean in and become a founder of my first startup here with Native.
I wish more people would consider that as a route to college. I would tell you, it might solve the student loan debt problem.
Yeah.
Really, you were super resourceful to do that, and it's obviously paid off handsomely for you. A lot of, engineering students will graduate with 6 figures of debt.
Right.
How do you do that? I don't know.
I don't know. And it's being pitched as the new norm, and you just got to do it, which I think is just a massive fallacy. But I think there might be a reinventing, especially through the vocational efforts, like you mentioned, and trade school and things of that nature. There's ways to get to the end without having to sacrifice everything to do so.
Yeah, for sure. For sure. Well, Tim, you started Native Orthopedics. Talk a little bit about the company formation, who's involved, and what is the problem specifically that you guys identified that you're uniquely solving?
Yeah, sure. So after I left big corporate, I had some time for self-reflection. A number of opportunities presented themselves to me, and I got approached by Dr. Chris Anderson. So he's a Nashville, Tennessee-based sports medicine surgeon, and we had crossed paths in prior roles, but he reached out to me and said, "Hey, I've got this great concept, and I would really love to bring it to the market. Instead of giving it to a big strategic, let's see if we could try to bring it to market fast. The timing is right because the market is just starting to talk about this as a problem, and there's no great solution out there." And I spent a lot of time with Dr. Anderson evaluating and putting together my mental roadmap of how I would build the company and bring it to market super fast. And what I loved was Dr. Anderson is just a passionate individual. He's fully immersed himself into this space, and he had existing IP. I think this is an important note for a lot of founders, right? So he started his intellectual property journey back in 2016. At the time, he had 10 issued patents with global coverage. So we've since rounded out the IP even further to fortify our competitive moat there. And I would say 12 issued patents today with over 30 pending, really strong IP position. So that was like a good foundation to build off of. And then having been in launching products all my life, I knew which individuals that I like to work with, right? And I went through my mental Rolodex of who I wanted to bring on board and who we could buy into this mission of bringing this technology to the marketplace
right
as quick as possible. So that's what we did is we assembled the team and built a company around it.
I'm curious on the IP. Did Dr. Anderson fund it himself, worked with a patent attorney and somebody to sketch it out and filed it himself and started it himself? Yeah.
Yeah, and it wasn't just some guy in a corner office. He actually hired Holland & Knight, the 5th largest IP firm in the country. They've done an exceptional job. I personally tried to design around the IP myself before I signed up for this.
Okay. That's a pro move too, right there.
Yeah, that is a pro move.
Yeah.
So it just gave me confidence that we had something that we could defend and continue to build around. And I've even solicited a number of the team members to just continue to build it out. So we've done a good job with that side of it. Dr. Anderson did fund a lot of that up front. And I think between the cash injection that he did initially, plus my investment, that gave us runway, right? That gave us runway through all of 2024 from when we assembled to FDA submission. And that was a big milestone. We first mentioned that at the get-go in the intro. We wanted to make sure we had funding to get to that significant milestone of FDA submission, which we did. But in parallel, I started thinking about, let's put together a pitch deck. Let's pull our story together and go out and start socializing this with the investment community.
Hi, listeners. As a medtech leader, you know how hard it is to scale up your sales team and prepare them for a successful product launch. If your reps are still digging through cumbersome shared drives and web portals, clicking through an LMS that no one uses, or relying on email newsletters to stay current, it's time for a change. Your reps, they're on the move. They need on-the-go content and a single source of truth. And that's where Convey Connect comes in. It's a mobile-first, company-branded app that gives your sales team instant access to training, sales tools, and company updates all in one place. At Convey Connect, we can have your customized, white-labeled mobile app deployed to the app stores in just a few weeks. So your sales team is resourced and aligned to win. So if you're scaling your team or prepping for a big launch, please check out conveymed.io, schedule a quick demo. We would love to show it to you. So now back to the show.
Yeah. And I'll tell you this, it's great to work with folks like Tom because they have both sides of the picture right? Which just makes them that much more efficient. And not only that, but the fact that the pressure testing of what I have to do in terms of engaging and talking through and things of that nature is, hey, this brother's already got it locked down. And I think it's important that founders think about that, right? What are you bringing to the table already? And what are you going to do to realize you may not be the smartest guy or girl in the room, and bring people around you that can help accelerate your vision?
That's a great point. Well, I think for surgeons, especially if you have a great idea, something you think is unique, it's probably wise to go ahead and make the investment to at least do the provisional patent filing, if not go the extra mile that Dr. Anderson did and build out a full patent portfolio, because it puts where you guys are now in a very strong position as you are out building your product. So talk about the problem you're solving. Talk a little bit about the product. What is Native Ortho building, and why does it matter?
Yeah, so great question, Mike. Meniscal root injury has been massively underdiagnosed, I'd say, for years. And if you follow the number of talks at society meetings, the number of studies that are being published in this space, it's really hockey sticked up over the last, say, 5 or so years. And there's no great technology solutions on the market. And that's exactly what Dr. Anderson was laser focused on, was solving this problem for himself as a former world record holder fly fisherman. And there's a great story here. He was used to line splicing and not having knots, and he wanted a knotless solution to specifically fix meniscal root repairs. So in general, Dr. Anderson was ahead of the curve, recognizing it was a problem, started his IP journey, and now the marketplace has caught up and surgeons are paying attention to this specific injury. I'll give you a stat. At the time of total knee replacement, there's over 1 million total knee replacements per year. 80% of those patients at the time of total knee replacement were found to have a torn meniscal root. 800,000 plus, right? So I think it just speaks to the fact that it's been underdiagnosed for quite some time. And now that surgeons and industry are paying attention to it, they're trying to repair it earlier in that disease cascade to eliminate the need, or at least delay the need of that patient needing a total knee.
Well, that's interesting. So how do you prove that?
How do we prove it, right? So osteoarthritis leads to pain and leads to instability and eventually that total knee. So there's multiple studies out there that I can cite. I can follow up with anyone that wants to get into the details that have shown how important it is to address the meniscal root. There's a ton of data that supports just removing meniscectomy in general does not lead to great outcomes. There's a ton of information out there that talks about how surgeons are treating these patients today with static fixation and how that doesn't necessarily lead to great outcomes. So it comes down to anywhere in the body, it's proven that having the right tension and the right compression is what leads to that patient healing. And we have a very novel device here with our ability to tension and retention and dial in the tension specific to that patient that gives that patient the best chance of healing.
Is it diagnosed with MRI? Can you visibly see the root tear?
You can.
On imaging? Okay.
It's on the posterior corner, so it's tough to see on the scope. And oftentimes that was one of the reasons why it was underdiagnosed. Surgeons didn't bring the camera over the tibial spine to reach that back of the knee to even see that it was torn. But now they're paying attention to it because, like I said, there's so many talks on it. Surgeons are looking for it now. And oftentimes it'll present itself with another injury like an ACL or something else, right?
Yeah. Or at the same time, exactly. And
at the same time, yeah.
To that point, Tom, we're entering an age, and this is great to be able to say this. We're entering an age that really has nothing to do with AI, but has everything to do with personalization of implants. And I think that's something that we've got to hold up in lights very brightly so that people really start to understand that it's not one size fits all. And it's not 7 femoral components for a total knee are going to take care of every single person on the planet. That's the thing. And so that's what I'm intrigued about the technology and making it very personalized and being able to play off that. To me, the expectation of the patient, okay, is probably greater for a best case outcome than it's ever been in history. I think some of that has to do with what we've seen from a trust factor in terms of even their healthcare providers. And is this really the best for me? And so we want to educate patients, as you are doing and as Dr. Anderson is doing, of ask that question and don't be afraid to ask that question.
A great point.
I'm curious, what's the mechanism of injury? Is it acute or is it chronic, or can it be both?
It could be both. Yeah, it could be degenerative condition. It could be just trauma or ski injury. Happens in athletes, high performance athletes. And a lot of people have a fantasy football team and their favorite player didn't return to the performance level that they had prior season. And oftentimes it's down to the surgeon and technical error and how they were able to dial in the right tension for that patient.
Yes. I like it too because of one big thing. When I picture a continuum of care for a total knee patient, this is one more cog of a well-defined solution, to your point, that can delay that eventual procedure, because we know, right? Mike and I, with the years that we've spent in the total knee, hip, trauma, you name it, markets, from a corporate standpoint, you've only got 2 shots in terms of a total and then a revision. And so the more time you're buying, the better that is. And so the question would come up, is there any mechanism that, let's say over time, there's a wear out or something of that nature? Is there an ability to come back behind this again with the Dragonfly 2.0?
That's just it. And that's the beauty of this technology is it's a super light touch and it allows the surgeon to preserve their ability to revisit the patient for whatever reason if they needed to.
Excellent. And I'm going to step a little bit out of the meniscus and just focus on the fact of what you're building is a platform technology. That's
right.
And I'll just leave that there.
Yeah. So I'm glad it could lead in, right? So originally when we formed Native, our website, our initial communications externally were, this is going to be a meniscal root repair offering. We're going to have the complete solution, implants, best in class instruments. We were aware of the shortcomings of all the instruments from even the biggest strategics, and we're going to do it better. And we did that. Mm-hmm. Along the way, I would say I recognize the value that we're sitting on here with this Dragonfly technology. After putting it into so many surgeons' hands in cadaver settings, the conversations would just flow into, I love this for root, but I also want to use it on ACL. I want to use it on MPFL. How about LETs? Right. So the sports medicine world has exploded about the number of opportunities we can take this technology and apply it. Mm-hmm. We've even had spine surgeons, gastrointestinal surgeons. There's a lot of scalability with this platform. Mm-hmm. Think of it as a surgical zip tie.
Is it because the repair is more robust, or is it because it's an easier, faster, more efficient operation, or maybe both?
All of the above. Yeah, all of the above.
That's great. That's great.
Let's shift gears and let's get into, sounds like you're close to being on the market. Maybe by the time this podcast goes, you'll be on the market. You'll have your first 510K approval. We'll have a big party. Talk about your go-to-market strategy. What are you thinking? What are your goals? What are the next milestones in this sort of commercial stage?
Yeah, so go to market, right? Obviously, we need to get our first FDA approval. We're working on FDA submission 2, 3, and 4 in parallel. Right now, what I'm finding the most traction with is having surgeons talk to other surgeons about this technology. And it's your key opinion leaders, guys that are in the ACL study group, guys and girls that are in the ACL study group, for example, your digital opinion leaders. So surgeons selling surgeons has been one of the biggest things that's helped us create some buzz in the community, and industry has taken note of it, and the investment community has taken note of it. So we'll probably start with continuing to drill down there. We're also going to transact directly with some large hospital systems. And then, of course, the conventional model of working with seasoned sales reps and distributors that have established relationships and are highly respected, and that can represent Native.
That's great. We're coming up on the Academy meeting, right? And the Canaccord Genuity meeting. You'll be a first-time exhibitor. That's a huge deal for AOS. I'd love to ask you, from your perspective, what are your expectations coming out of that?
It's our coming out party, right? I know it's a little booth, but it's our opportunity for us to really just be official at a big academy association like this. And it's a little bit of a practice run for us in getting the booth convention metrics and logistics down. We're going to have presence at the big sports medicine upcoming events like AOSSM, which is coming up in Nashville in July. We'll also be at OSET in Las Vegas in September. And hopefully by then we've got a couple of more clearances under our belt. So our expectation is we're going to be meeting with a lot of surgeons. We know we've had unsolicited a number of distributors reach out to me directly and ask to book time on my calendar and have conversations if they can pick up this product line for their area. And some of them, they're maybe carrying one of the major strategics as their main portfolio, but those major strategics don't have an offering in the space, and contractually they're allowed to pick up technology like this. So I'm going to have a lot of those conversations as well. We've got press, we've got meetings with strategics as well. I guess I'll just say, right. So there's some interesting conversations happening with all the major players that have signaled to the investment community and their shareholders that they want to grow in the sports medicine space. Yes. And this is something that when I build a company like this, like my plan was for it to be with a nice bow on it, that it can drop right into the sales channel of any of the strategics.
That's really important. Talk more about that, Tom. We were chatting offline how selecting the vendors with whom you're working with was really important. And given your history with J&J, you have a lot of connections. Probably helped that you did a lot of due diligence for some acquisitions too. Talk a little bit about how important it is to really carefully select who you work with as you are bringing product to market, whether that be manufacturing vendors, supply chain, the whole gamut.
Yeah, this is education for first-time founders in the medtech space. Your deal can potentially fall apart at the finish line if you don't have the right supply chain in place. So I decided to only do business with suppliers that are already on the approved supplier list for all the major strategics. That was super important for me to make sure that we're working with suppliers that, number one, are going to meet our supply demands, but number two, have the right quality systems in place and validations in place that when they go under interrogation through diligence by a major strategic, we're going to pass it with flying colors. That was the plan.
So important. Absolutely critical from really the beginning of a company's formation and develop R&D process to have that quality system in place and work with vendors, like you say, where the handoff can be smooth.
Right.
Yeah.
It's critical. So as you think, Tom, about 2025, 2026, these are definitely going to be growth years, banner years for the business, and there's no doubt about that. From an ongoing education standpoint, I know you already do and things of that nature for surgeon education and whatnot. How big do you want to make this lab circuit be in terms of reach in the coming 12 months?
Yeah, so I'd say laser focus on some key geographies and get penetration in those key geographies first, Chris.
Yes.
We want to show penetration and also stickiness in those key geographies.
Yes.
So we've got our top 10 areas and we're going to focus there. But the nice thing about that is you show that penetration, it becomes more attractive to a big company because then there's validation that when they put it in their sales channel, it can scale nationwide and actually globally.
That's correct. And I love the fact there's two different approaches I watch founders make. And one of them is, let's just get out there and sell. Well, the reality is that's not a strategy. That's not a strategy. The approach of being targeted, the approach of going deep, not wide within institutions is critical because at the end of the day, all the strategics that are looking at your business model are going adoption and reutilization are what make the world go round for them. And so that's the big thing they want to see. It's not just a number posted on the board. It's these many guys, these many girls have continued to use this technology over this period of time within these institutions, which shows, to your point, the stickiness and the ability for the acquirer to eventually be able to go out there and repeat the same on a greater scale.
Right.
Yeah, well said. Well, as we wrap up, I'll ask you a general question. What's the best advice you've ever gotten as a founder? You've been a founder not for a terribly long time. You've done a lot in a short amount of time, Tom. Very impressive. What's the best advice you've received as a founder?
It's discipline. You have to cut out the noise, especially as a first-time founder. You're going to be peppered with incoming messages from everywhere. In the end, what matters is bringing the innovation to the marketplace successfully, differentiated innovation to the marketplace as fast as you can. So laser focus. And if you can bottle up that energy and get the entire orchestra all marching to the same beat with that laser focus, you can condense your timeline and bring that innovation to the market successfully as you planned, as fast as possible. And then it's rinse and repeat, right? We have a plan to continue to round out our pipeline, and we're excited. We have a very exciting pipeline behind these initial launches, and we're just going to keep the wheels going.
Awesome.
That's awesome.
That's great. Tom, where can people find you if they're looking for you?
So we have an office in Providence. I'm actually in my home office today, one of my home offices. So LinkedIn, we're definitely on LinkedIn. And then also we have a website, nativeortho.com. So our initial website is getting phased out this week. And the plan is just before Academy to launch our website 2.0, which will give a little bit more insight to the marketplace around our Dragonfly technology and why it's exciting and why everyone should care about it.
That's
awesome.
Great.
Well, all the best to you, Tom, and thanks for taking time to join Chris and I and jam out a little bit. We will see you. This will air after the AAOS, but we will see you at the AAOS and give you a fist bump and see whatever we can do to help you. And yeah, so thanks again. Congratulations. Yeah. All right. Another jam session in the books, Chris.
Yes. I'm telling you, everybody, you got to tune in because these are only going to continue to be educational, continue to be fun, and continue to be eye-opening. I think there's a lot of learnings regardless of the role you play in our healthcare ecosystem.
I agree. Yeah. You can find us wherever you get your podcasts, on Apple Podcasts or Spotify. And the video's on Spotify too, so you can see Tom's amazing background and the beach in the background. So awesome. All right, gentlemen.
Yeah. Thanks, Tom.
Thank you. Take care.